Hello everybody, my name is Ben Blacklock. I'm a senior lecturer in veterinary ophthalmology based at the University of Edinburgh, and I teach on quite a few courses for Improve International, including their certificate courses. I just wanted to record a quick video and give you 5 top tips when you're seeing an eye case in practice. So these 5 tips are all things that you can do in the consult room, and let's start from the beginning. So number 1, don't forget the Schirmer tear test. It's a really easy to perform test. I'm sure you're all very familiar with it, but it's often forgotten, especially in that excitement of seeing an eye case. Number 2, when you're using fluorescein, remember you don't need to use very much of it, and remember to give it a really good flush after you've applied the fluorescein. I like to use the fluorescein strips, the little orange florets, which you moisten with a drop of saline, touch to the conjunctival surface, so that usually the bulbar conjunctiva, blink the eyelids a few times and then give it a really good flush. And the fluorescein will stick to what it needs to stick to, but it won't completely flood the eye. Tip number 3, any corneal ulcer that looks like it's deeper than the corneal epithelium, I'd strongly recommend you do corneal cytology, and it's really going to guide your antibiotic usage and indicate how frequently you might need to treat that eye. Tip 4, don't just automatically reach for Isothal when you're treating a corneal ulcer. Although it is licensed for conjunctivitis in dogs and cats, it's not technically licensed for corneal ulceration. It's also got an awful lot of resistance out there to the fusidic acid, so we would tend to use a chloramphenicol eye drop 4 times daily for most simple corneal ulcers. Now that's a very general rule, but you won't go far wrong if you start reaching for the chloramphenicol rather than the Isothal for corneal ulcers. And finally, to stick with corneal ulcers, just a little word of warning: don't be tempted to debride ulcers other than what we call SCEDs, or spontaneous chronic corneal epithelial defects. So if you have a SCED, of course, please go ahead and debride it, probably no more frequently than every 10 to 14 days. But if you've got a deeper corneal ulcer that isn't healing, don't be tempted to debride it. The underlying pathology is quite different, and you can often make the situation much worse. So I hope that's interesting. 5 very quick top tips from me. Good luck with all your eye cases, and perhaps see some of you soon.